So for the annotated questions number 86 to 90, number 86, the seventh cranial nerve exits from the cranium through the letter A, stylomastoid foramen, letter B, foramen lacerum, letter C, anterior infraorbital foramen, and letter D, foramen spinosum. The correct answer is letter A, which is stylomastoid foramen, because it courses through the facial canal in the temporal bone and exits through the stylomastoid foramen, after which it divides into terminal branches at the posterior edge of the parotid gland. Letter B is not the correct answer because the two nerves that pass through the foramen lacerum are the greater petrosal nerve, which represents the preganglionic parasympathetic fibers, and the deep petrosal nerve, which represents the postganglionic sympathetic fiber. Letter C is not the correct answer because the infraorbital foramen is located below the inferior orbital rim on the facial surface and transmits the infraorbital nerve, which is a division of cranial nerve 5 and vessels to the base. Letter D is not the correct answer because the foramen spinosum is a small open hole in the greater wing of the sphenoid bone that gives passage to the middle meningeal artery and vein, and the meningeal branch of the mandibular nerve, which sometimes it passes through the foramen ovale instead.
For number 87, which of these venous sinuses is connected to the pterygoid plexus of veins? The right answer is cavernous sinus, since cavernous sinuses are 1 centimeter wide cavities that extend a distance of 2 centimeters from the posterior aspect of the orbit to the vitreous part of temporal bone. They are bilaterally paired collections of venous plexus that sit on either side of the sphenoid bone. A, the transverse sinus is not the correct answer because it's a paired venous vessel that runs through the tentorium cerebelli and it begins at the internal occipital protuberance of occipital bone and they terminate by giving off the ipsilateral sigmoid sinus. The sigmoid sinus is not the right answer because it arises from the level where the transverse sinus leaves the tentorium cerebelli and the sigmoid sinus courses along the floor of the posterior cranial fossa to enter the jugular foramen. The superior sagittal sinus drains the lateral aspect of the anterior cerebral hemisphere. Just like in this picture, the cavernous sinus via emissary vein. For the 88, the embedded parts of the periodontal ligament in the bone and cementum are the sharpest fiber because the portion of the principal collagen fibers of the periodontal ligament embedded in cementum and alveolar bone to attach to the tooth to the alveolus. The elastic fibers is not the correct answer because they endoconnective tissues such as blood vessels, lungs, and skin with the critical properties of elasticity and resilience. Harris-Sicker's theory is not the correct answer because it attributes tooth eruption to a cushion hammock ligament beneath the tooth. The oxytolin fibers are not it's not the correct answer because it has no elastin and bundles of microfibers which are predominant. The zygomatic arch is the region of each muscle of mastication. The right answer is the masseter because the region of masseter is lower edge of zygomatic bone and insertion of masseteric tuberosity of mandible. The temporalis is the origin is the squama of temporal bone, greater wing of sphenoid bone, and temporal fascia. The insertion is coronoid process of mandible, and the vaccinator is the origin is superior part from outer surface of the alveolar process of the maxilla opposite to the three maxillary molar teeth, and while the zygomaticus muscle originates from the lateral surface of the zygomatic bone, just anterior to the zygomatico-temporal suture and lateral to the origin of zygomaticus minor.
So for the number 90, hypocalcified areas in the root dentine are letter A, granular layer of tones, letter B, interglobular dentine, Letter C, zone of whale, and letter D, contour lines of Owen. The correct answer is letter B, which is the interglobular dentine because it could be defined as a hypomineralized or hypocalcified area in dentine. Dentine is an example of such a tissue and it forms dead tracts, tertiary dentine, and sclerotic dentine in response to external stimuli. Letter A is not the correct answer because Tome's granular layer is also called granular layer of Tomes or granular dentine. Letter C is not the correct answer because the cell-free zone of whale is also called subodontoblastic layer or Hale's layer. The cell-rich zone lies next to the pulpal core and bends with it. The pulp core zone comprises prominent blood vessels and nerves and is present below the cell-rich zone. Letter D is not the correct answer because some incremental lines are accentuated due to disturbances of mineralization and are called as contour lines of Owen. These lines indicate a phase of mineralization and follow the outer contour of dentine, and these lines represents a hypocalcified bands. And that would be all. Thank you.